some of you may know what I, all right. So some of you may know what I do already anyway, but I am a community educator and I also am an insurance broker as well. So I know that all of you are probably used to Zooming and a lot of you probably like to use the chat box. But as you can imagine, for me to read the questions in chat would be a little bit awkward with you all staring at me and that sort of thing. So I'd like to ask you, if you have a question, to unmute yourself and just ask the question. However, you know, if I don't make something clear, I do want you to stop me and say, hey, I didn't get that. Because if you didn't get it, someone else probably didn't get it either. So that you can do so at any time. And whatever subject matter I'm talking about, I will usually say, is everybody, you know, good with this? Or do you have any questions? And if I don't say that, and if you have a question, please, you know, again, you don't have to raise your hand, just unmute yourself and ask the question about that subject matter. However, if you have something totally unrelated to whatever I'm talking about at the moment, maybe you could just hold that question to the end, okay? Because sometimes that happens like that too. So I'm going to go ahead and start. And I thank you for those people who I can see, because it really helps me to be able to see part of the audience. So sometimes people think that Medicare Made Easy is a very funny title for Medicare, but that is my goal, is to break down the parts of Medicare so that it becomes easier to understand, because I realize that you are all experts in your own fields. But now when you're starting to think about Medicare, it can be a little overwhelming. So let's try to take that feeling of being overwhelmed away from you. So in this, to start with, I'm going to talk about the very basic information of Medicare, like there's 4 parts and what each part really means. And you'll think, oh, okay, this is pretty basic. And then we'll build on that foundation. And then I'll just give you a brief overview of the 4 parts of Medicare. And by the way, I had, you know, I'm sure that you all have the handouts that Janine sent to you, because you'll have all this information, I think even including this PowerPoint. And then we'll talk about the choices Medicare gives you on how you can get your coverage, because we as consumers tend to like choices. So Medicare gives us choices on how we receive our coverage. And then we'll talk about Medicare eligibility. That is just one slide. It's very brief and straightforward. But then when we talk about enrollment, there are, you know, different situations. Some of you may be working beyond the age of 65, and, you know, maybe you can enroll a little bit later than age 65. And we want to make sure that we spend time on that so people do what is best for their situation. And then we'll talk about the benefits of original Medicare Parts A and B. And as you notice, I do call it original Medicare, traditional Medicare, because the Medicare that I speak about tonight is the same Medicare that was developed back in the 1960s, where we are free to use any Medicare approved physician in the country. So that is called original, and sometimes it's called traditional Medicare. And then even though Medicare, as you probably know, is pretty good coverage, it doesn't cover everything. They leave us with deductibles and co-payments and co-insurance amounts to cover. So what some people choose to do is buy another insurance policy called a Medicare supplement, also known as Medigap. And this Medicare supplement plan that comes from an insurance company can help close the gaps that Medicare A and B leave you to pay. And then, of course, we'll have questions and answers. Hopefully I'll have the answers for you. And then I have a very brief 3-question quiz. It's not right or wrong. It's just that I have found over time, because by the way, I've been giving programs like this for 14 years now, and I've been working with people on Medicare since 1992. So I have found that there are a few different things that people get a little bit confused about. So I'm sure that you won't be confused about those things anymore by the time we get to the quiz. So some basic information. Medicare is simply health insurance provided by the federal government, and it is divided into parts. Medicare Part A helps pay for hospital care and skilled nursing facility care and other services. However, most of us associate Medicare Part A with a building, a hospital, a skilled nursing facility, and Medicare Part A helps pay for our stays in these facilities. So Medicare Part A is premium free for most of us because all the years that we are working, we are paying into the Medicare system. And as long as we have 40 calendar quarters paid into the system, we receive Medicare Part A premium free. Now, some of us may not have Medicare covered employment, but hopefully our spouse did, and then we can qualify for that premium free Medicare Part A under our spouse's work record. So Part A, hospital, skilled nursing. Medicare Part B, that's for physician charges and outpatient tests and outpatient surgery and emergency room and ambulance and many things. So Medicare Part B is really the part of Medicare that we typically will use more of during our lifetime. Now, Medicare Part B does have a premium associated with it, and that standard monthly premium this year is $148.50 per person per month. You probably noticed that I said standard because Medicare Part B can cost some people more than $148.50. There is something called IRMA, Income Related Monthly Adjustment Amount. And so when a person signs up for Medicare Part B, Medicare and Social Security, government entities will check with the IRS to say, what was that person's adjusted gross income 2 years prior? So if I am applying for Medicare Part B for 2021, they will want to know what my adjusted gross income was from 2019. I don't need to supply that to them. They will find out from the IRS. So for a single taxpayer, if your adjusted gross income was less than $88,000 in 2019, you will pay the $148.50 per month. If, as part of a married couple, your adjusted gross income was less than $176,000 for 2019, you will each pay the standard Part B premium of $148.50. However, if those adjusted gross income amounts were over those thresholds that I gave you, then you will pay more for Medicare Part B. How much more? It depends on how much higher you are over those thresholds. So in one of the handouts that you have, it's called 2021 Medicare costs. And on page 2 of that handout, or the, maybe you downloaded it, printed it, whatever you might have done with it, on page 2, it gives the chart about those income related monthly adjustment amounts. And Medicare and Social Security look at our incomes every year, the whole time that we're on Medicare. So just to be aware of that. So if you start out paying an income related monthly adjustment amount and your adjusted gross income falls down below those thresholds that I gave you, then you'll revert back to the standard premium. However, if you start out the standard premium and for some reason that adjusted gross income goes up over those thresholds, then in the future you might have to pay more. And they look at this every year. So Medicare Parts A and B are considered original Medicare. Like I said earlier, with original Medicare, we are free to use any doctor, hospital, and other providers that accept Medicare. So a lot of freedom of choice with original Medicare A and B. And as I said earlier, but it is worth repeating, Medicare Parts A and B provide good coverage, but they don't cover everything. They leave us with deductibles and co-payments and co-insurance amounts to pay. So a deductible is what we're responsible for before the insurance company, in this case, Medicare, starts to pay anything. A co-payment is a fixed dollar amount that we would pay for a service, and I'll show you those in a little while. And a co-insurance is a benefit percentage, something like 80-20, that sort of thing. So you would pay a percentage. So with original Medicare A and B, you can choose to be responsible for those costs, or you can choose to purchase an insurance plan to help you with the cost. And that's what is known as a Medicare supplement, also known as Medigap, because everything has more than one name. Why, I don't know, but I could talk about Medicare supplements all night long, and someone will say, well, tell me about Medigap. And actually, it's exactly the same thing. And I think this was part of your attachments too. If not, let me know and I can send you one. But there is the 2021 Medigap Medicare Supplement Guide that Medicare publishes. And that's a very handy booklet. It's a federal booklet. So Medicare supplements supplement your original Medicare Part A hospital and Part B medical coverage. If you want to call it a Medigap, then actually you can just look at it as it closes the gaps that Medicare A and B need you to pay. So what about prescription drug coverage? We've talked about Medicare A, hospital, and B, medical, but Medicare A and B don't cover outpatient prescription drugs, and neither do Medicare supplements. However, prescription drug coverage is available to everyone with Medicare, and it is called Medicare Part D. It has been around since 2006, and Medicare developed Medicare Part D and then said to insurance companies, if you want to sell Medicare Part D, you can do so, but they have to sell at least what is known as the standard program that Medicare developed, but insurance companies can offer more enhanced plans. So you have many choices when it comes to Medicare Part D. There are 29 choices in Illinois this year. Now, tonight's program is really about Medicare A and B and Medicare supplements, and I'm going to stick to that. But I don't want to let you I don't want you to not know how to find out about prescription drug coverage. So Medicare.gov, not Medicare.com, but Medicare.gov is a great source for you to see all of your Medicare Part D choices. So if you are already on Medicare or have your Medicare number or receiving it soon, you can go to Medicare.gov and create a Medicare account. And I suggest that everybody do this. And if you're better on the computer than some of your friends, maybe you can do it for your friends. So you just need a Medicare number and then some very basic information about yourself. You create a username, which is usually your email address, and then you create a password just for yourself, and that's it. Then you have a Medicare.gov account. And if you like, you can plug in all the prescriptions that you take, if you take any, and then plug in some pharmacies that you would use if you have the drug coverage. And this awesome software program will show you the most cost-effective drug plan for you based on those prescriptions. So it's something that you really want to utilize. And it's something that I utilize every day because there are 29 choices and everybody has different needs. So Medicare.gov, great source for you for your Medicare Part D choices. Now, currently, only the 2021 plans are being shown on Medicare.gov, but starting Friday, October 1st, they will also show the 2022 plans. Since I'm guessing that some of you who are on here, you might not be turning 65 until next year. So Part D senior savings model that was new for this year. And I like to keep it in here because sometimes people who take injectable insulin really worry about the cost of that. And I just wanted to let you know that the senior savings model was introduced this year, where there are 9 different plans of those 29 that I mentioned that will offer certain insulins at a $35 copayment for a 30-day supply all year long. So that is good to know as well. So back to the basics. Original Medicare, Part A hospital, Part B medical. Some people complement that with a Medicare supplement plan, Medicare Parts A and B it's supplementing Medicare Parts A and B by helping with the deductibles, co-payments, and co-insurance. And then if they wish, and most people should, buy a Medicare Part D prescription drug coverage. Great. So that is really one way in which you can get your coverage. But you probably noticed I forgot a letter of the A, B, and C, D, right? Because I said there were 4 parts. So when you're first enrolled in Medicare, you will have original Medicare A and B. And you can choose to stay with that original Medicare A and B and maybe buy a supplement and a drug plan if you like. Or because this is the choice that Medicare gives you, you can choose to join a Medicare Advantage plan. A Medicare Advantage plan is an alternative way of receiving your Medicare coverage. It typically comes in the form of an HMO, Health Maintenance Organization. And with an HMO, you typically need to choose a primary care physician, and that primary care physician refers you to specialists if you need to see them. And with an HMO, if you go outside of the network for anything but emergency or urgent care, you may pay more or all of the costs. They also come in the form of PPOs, and PPOs are participating provider options. And most of us know what these are because we've been having these options available to us most of our working lives. So a PPO offers you a little bit more flexibility because if you stay in the network, great, you get maximum coverage. If you go outside of the network, you get lesser coverage, but you still get coverage. And with a PPO, you don't need to choose a primary care physician, and you typically don't need referrals, but there may be a case or two where a referral might be needed for some services. So a Medicare Advantage plan is also known as Medicare Part C. Just to give you a little bit of information on Medicare Advantage plans, I've dedicated 2 slides to this. The reason I did that is because I know that next week, all these commercials are going to start and everybody's going to want to know what a Medicare Advantage plan is and how it's different than a Medicare supplement. So that's what I'm going to help you with now. So Medicare Advantage plans are available through Medicare approved private insurance companies, and they must follow rules set by Medicare. So most of the insurance companies that are selling Medicare supplements, many of them are selling Medicare Advantage plans too, because you have choices. If you decide to join in a Medicare Advantage plan, you'll receive most of your Medicare A and B coverage from the Medicare Advantage plan that you choose, not original Medicare. So if I have original Medicare and I enroll in a Medicare Advantage plan, now I am choosing to receive all my medical coverage, most of it, from that Medicare Advantage plan. I'll always need to continue to pay that Medicare Part B premium. Now, there are some people that may get a rebate on that Part B premium. Maybe they were part of a, they were in the service and they sign up for these special plans just for veteran affairs people. So they may get a rebate, or if people are eligible for Medicaid, they may not have to pay their Part B premium. But most people do have to pay your Part B premium if you're in a Medicare Advantage plan. Medicare pays a fixed amount for your coverage each month to the companies offering Medicare Advantage plans. So some of you have probably seen Medicare Advantage plans available in the open market where it's a $0 premium. And of course you wonder, how do they do that? How does it not cost me anything to be in that plan? Well, a couple different ways. Number one, Medicare is paying them to take care of you, because once you enroll in a Medicare Advantage plan, Medicare is not responsible for your care. So they pay them a set amount to take care of you. And that plan then has the task of managing your Medicare benefits. And also with Medicare Advantage plans, even though your premium may be low or $0 premium, you will have costs for your services when you receive them, for primary care visits or specialist visits, hospital stays, skilled nursing stay, etc. So you really want to do your homework when you're looking at a Medicare Advantage plan, because there's really no right or wrong way to get your Medicare coverage. You just want it the way that you're most satisfied. So that's what's important. Someone entered the meeting room. I guess maybe I can admit, I don't know. Okay, I guess I admit it. Okay, excuse me about that. Most plans include your Medicare Part D coverage. So a Medicare Advantage plan can include your Medicare Part D, and most of them in Illinois do that. In most Medicare Advantage plans, you will need to use the doctors, hospitals, and other providers who participate in the plan's network, or you may pay more or all of the cost. With some plans, you may need referrals. You may pay a monthly premium in addition to your Part B premium for that Medicare Advantage plan. There are co-payments and co-insurance amounts that will be your responsibility for covered services. These costs vary by plan. So when you're looking at a Medicare Advantage plan, you want to find out, are your doctors in the network? Are your hospitals? Are there skilled nursing facilities that you would prefer to go to if you have to go in one? Are they in the network? You want to make sure about all of those things before you make your decision. Plans can offer extra benefits, and that's nice, like vision, and that would be for routine vision with the help of glasses, maybe dental and hearing aid coverage. Each plan has a yearly limit. This is very important. Each plan has a yearly limit on your out-of-pocket costs for all Part A and P medical services. This is called a maximum out-of-pocket limit, MOOP, M-O-O-P. If you reach this limit during the calendar year, you'll pay nothing for Part A and Part B covered services for the remainder of that year. And of course, you would reach that limit, of course, using, doctors and hospitals inside the network and following the plan's guidelines. Remember, if you are in a Medicare Advantage plan, you will use that Medicare Advantage plan card to receive your Medicare covered services. And you will have the option each year to keep your Medicare Advantage plan or choose a different one or switch back to original Medicare. So we've covered a lot. And now I'm just going to go over that in summary. I also sent you a sheet that gave you a brief paragraph about what Part A is, Part B, Part C, and Part D, just in case you forget. Part A, hospital. Part B, medical doctor, surgery, outpatient care. Part C, Medicare Advantage plan. Part D, prescription drug coverage. So what are these choices? I think you know what they are. Original Medicare A and B, and that's on the left side of my screen. Original Medicare Part A and B, where you have Part A hospital and Part B medical. You can add prescription drug coverage, Medicare Part D, and you could also add a Medicare supplement plan if that's what you choose to do. And that would be one way that you can receive your Medicare coverage. Or you could say, I have original Medicare A and B, but I'm going to enroll in a Medicare Advantage plan. And that Part C, you can think of that C as standing for combine. It combines Part A, Part B, and usually Medicare Part D all into one plan, a combination plan. So if your Medicare Advantage plan includes prescription drug coverage, you wouldn't need to buy another Medicare Part D plan. And then down at the bottom, it says, when you enroll in a Medicare Advantage plan, you cannot also have a Medicare supplement insurance plan. Well, why would you really want to though, right? Because if you're enrolled in a Medicare Advantage plan, if you have a Medicare supplement plan, it's not going to do anything for you at all. Because a Medicare supplement is designed to work with original A and B. And once a person enrolls in Medicare Advantage, they are taken out of original Medicare. You still have your card, but and you can still you still are in Medicare, but you are not receiving your medical benefits from Medicare if you're in a Medicare Advantage. So if a person stays in a Medicare supplement plan for whatever reason, they are just throwing their money away. And I've seen a couple people where they kept their Medicare supplement plan in addition to their Medicare Advantage plan. And they just wasted their money. It was really difficult. It was just like, no, you cannot do that. And so at any rate, just bear that in mind. So I just talked about a lot, and we're not even a third of the way done. So do you have any questions about what I discussed yet? Are you all still there?
Yes.
Okay, thank you. Okay. So, and don't be shy about asking a question. So who is eligible for Medicare? Eligible U.S. residents include people age 65 years of age and older, and eligible for benefits under Social Security or the railroad retirement system. So we all pretty much know that, Medicare is available to people when they turn 65, but it also can be for people younger than age 65. If they have been receiving Social Security disability benefits for at least 24 months, they will automatically be enrolled in Medicare in their 25th month of receiving those Social Security disability benefits. And then for people receiving regular dialysis, or if they've received a kidney transplant due to end-stage renal disease, they are eligible for Medicare at any age, the same way with people who are diagnosed with ALS, which is also known as Lou Gehrig's disease. So just to reiterate, Part A, premium free for most people, right? Because all those years we were working, we're paying into the system, 40 calendar quarters. Medicare Part B is not premium free. The standard premium for this year is $148.50 per month per person. And I'm sure the standard premium is going to be increased for next year. I don't know what that amount is yet. Oh, and by the way, I forgot to say this. So the Medicare and U book, I'm sure you can all see this. If some of you have someone at home in Medicare already, you probably have this book. The 2022 version should be coming out shortly. So those people already on Medicare will receive that. If you're not getting Medicare yet, you can go to Medicare. If you're going to ask me a question in chat, you might want to ask me verbally. At any rate, if you go to medicare.gov, you can download this booklet and read it on your electronic device, or you can call 1-800-Medicare and ask them for a copy. And actually, the library probably has one in the reference section of the library as well.
Diane, I have a question.
Sure.
Hi, I'm Linda. My
Hi.
husband Jake and I are here. He is on the supplemental plan. Medicare Advantage. I'm sorry. We've had some issues with it, and I'm just wondering if can you recommend which plans are better?
Can I personally do that?
Well, as a consumer.
Actually, I wouldn't do that in this type of venue because this is educational only, Linda.
Okay.
I can't talk about different prescription drug plans or Medicare Advantage plans. That would be breaking the rules. I can talk about Medicare supplements. I just can't talk about those. If you wanted to reach out to me separately, you could tell me what your issue is and maybe how it can be handled differently with a different company. I'd be able to do that, but I can't do it like this. Okay.
Do you have an office in the suburban area?
Well, I live in Palos Heights, but I work out of my house. So actually, since the beginning of COVID, I do everything by phone now, by phone or Zoom, whichever a person prefers.
All right, we'll reach out to you. Thank you. Thank you for that.
You're welcome. Okay. Is it okay if I move on? Any other questions? So Medicare enrollment period. So we're going to spend a few moments here. The initial, obviously, the beginning of your enrollment period, the special for special situations, and the general, that would be for people who missed the initial or the special enrollment period. So signing up for Medicare, you can sign up for Medicare Part A and B during the 7-month period that begins 3 months before the month you turn 65, includes the month you do turn 65, and ends 3 months after the month you turn 65. So for an example, my birthday's in October. I had to think about that for a second. And so July, August, and September, that's when I can sign up for Medicare. My coverage would be effective October 1st. I could also enroll in October, November, December, or January. But keep in mind, if I do that, my coverage will be delayed. I'll show you the chart in a few moments. So if you're turning 65 November 1st and you want Medicare to kick in if you're turning 65 during the month of November and you want that coverage November 1st, as many people do, sign up before November 1st. All right. So if you enroll for Part A and B coverage before your birthday month, in most cases, your coverage begins the first day of the birthday month. So do I have anybody born on the first day of the month? You don't have to answer. If you do, were born on the first day of the month, your Medicare coverage becomes effective 1 month early, okay, which can be nice. So that's the initial enrollment period, but let's talk about how you get that pretty card. It is a pretty card, isn't it? So for people already collecting Social Security or railroad retirement benefits, you will automatically receive your Medicare card in the mail about 3 months before your 65th birthday month. Why? Because if you're already receiving Social Security, they're sending you a check. I mean, like kind of, you can think of it like that they're sending you a check. They're usually just depositing it somewhere. But Social Security is the organization that handles the enrollment for Medicare. So they can see that John Smith is already getting Social Security. So they're just going to automatically send him his Medicare card about 3 months before his 65th birthday month. It'll just automatically appear. Okay. And remember, your coverage begins on the first day of the month for most people. So even if your birthday is the 31st, it'll still be October 1st. The only exception are those people born on the first day. And why is it like that? I have no idea. But for those people born on the first day of the month, it makes them very happy. So what if you're turning 65 soon and you're not yet collecting Social Security or railroad retirement benefits? Then you're going to need to sign up for Medicare during that initial enrollment period. Now, before COVID, some people could just call up and make an appointment and run over to that Social Security office over on Roberts Road, which has a very good reputation, by the way. However, even though they're still working, they're not seeing people face to face. So what I've always recommended to do for years now is just go online and enroll. You can go to SSA, Social Security Administration.gov, or Medicare.gov, and you can sign up for Medicare A and B. Now, if you go to Medicare.gov, you can say, I want to sign up for Medicare A and B only, and it'll take you to the right spot on the Social Security website. And all it will really want you to do is make sure that you have a Social Security account first. That does not mean that they want you to collect Social Security. They just, most of us should have Social Security accounts now so that we can see what we're going to get whenever we begin to collect. So if you have that Social Security account, then you can sign up for Medicare A and B. If you don't have a Social Security account, you're just going to have to create one. That's all. But you can sign up for Medicare A and B only. Now, most people can do it online. I've had a couple people, like if they weren't born in this country, or maybe they're collecting it under someone else's work record, maybe they have not been able to do it online. But that's why I suggest do it early. So if there are any problems at all, you have plenty of time to fix them. So some of you may say, well, geez, I don't have a computer at home and this is not what I want to do, like at the library, because you might think that someone's like peeking over your shoulder or something. So then you can call Medicare or call Social Security, and they'll set up an appointment with you over the phone for a date in the future that you can enroll in Medicare A and B on the phone. Okay, so pretty easy to do that. And then, okay, so this is what I want to say to you. So even though you have a 7-month window in which you can enroll in Medicare A and B during your initial enrollment period, if you don't sign up before your birthday month and you wait to the month of your birthday, your coverage is delayed by 1 month. You'll be unhappy. If you wait till 1 month after you turn 65, they'll delay it 2 months. 2 months after you turn 65, they'll delay it 3. 3 months after you turn 65, they'll also delay it 3. So avoid any disappointments by signing up for Medicare before your birthday month. So we've talked about the initial, and now we have a special enrollment period, because I bet you that at least 1 or 2 or more of you, either you or your spouse, may still be working. All right. And maybe you're just going to keep on working for a few more years. So some people may choose to delay enrolling in Medicare Part B because they or their spouse are still working. After the initial enrollment period has ended, they may be entitled to a special enrollment period. Qualifications for a special enrollment period are if a person or their spouse is still working for a company with 20 or more employees and they are covered under that employer's group insurance plan. So if you're going to continue to work for a company, I don't know, Chicago Tribune, something like that. If you're going to continue to work for the Chicago Tribune as a full-time employee and you're covered under their employer's group insurance plan, you can delay enrolling in Medicare A and B if that's what you wish to do. Now, most people would still just sign up for Medicare Part A, and there's certainly nothing wrong with doing that. You might as well. But the Part B, you have to pay for. So unless your coverage at work is really terrible, you might want to consider delaying enrolling in Part B until you're ready to retire. So usually, like if someone comes to me like just about this time of year, right? It's September 67, there's someone 67 and they're saying, oh, I'm going to work till December 31st of this year. So I need coverage for January 1st. It's very common. So I say, well, then I would start the Medicare Part B application process probably in the beginning of October. Now, if you asked me this question a year ago, I would have said they could wait 2 months before they need it. But I don't know if any of you have experienced this lately, but Social Security is a little slower than usual, and I don't know why. So I would start that Part B enrollment process 3 months before I need the coverage. What will that person need to do if they've delayed enrolling in Part B because of actual current employment and being covered under that group insurance plan? They'll need to fill out 2 forms. One is an application for Part B, very straightforward. The other form they'll partially complete and have their employer complete the rest, where their employer is basically stating that, yes, this person has been covered by them since they turned 65 and has had, coverage due to active employment. Those 2 forms will go to Social Security. So this person will not get penalized. So the type of situation, so the situation here where a person has 20 or more employees and they're continuing to work and they're covered under the employer's group insurance
I'm on this
plan.
call here for Medicare.
Pardon me?
I thought you were, what?
Want me to put the pizza away?
Yeah,
Unless you're talking to me, you might want to mute yourself. We can hear you. I don't know if you're asking me a question or not. Okay, this type of situation that I just described here would allow the person to sign up for Part B during a special enrollment period. So they could sign up for Medicare Part B while they're still working and covered by the group health plan, or during the 8-month period that begins the month after employment ends or their coverage ends, whichever happens first. This special enrollment does not apply if you are still in your initial enrollment period. So would I ever suggest for someone to wait 8 months after they've left work to sign up for Part B? Never, because you want, when your coverage at work ends, you want your Medicare coverage to kick in the first of the month of the following month, right? The first of the next month. So any questions on this? Because even though this is a short slide, it usually generates quite a few questions. No? Everybody's retired? Okay, so let's go back. General enrollment period. Okay, this is for those people that didn't sign up when they were first eligible and they don't have a special enrollment period available to them. So they can sign up between January 1st and March 31st of each year, the first calendar quarter, but their coverage will not begin until July 1st, and they'll be assessed a penalty. They'll have to pay a higher Part B premium because of this late enrollment. The higher Part B premium is basically a 10% penalty for each 12-month period they were without Medicare Part B. So $148.50 is the standard Part B premium. 10% of that is what, $14.85. If I skipped out on Part B for a year for no reason, just because I didn't, sign up for the coverage, then I'm looking at about an extra $15 a month right off the bat. Okay. If I skip out on it for 2 years, then I'm looking at an extra $30 a month. And that late enrollment fee, because the Medicare Part B premium changes, and since it's based on a percentage, that can change every year. That penalty would last a person's life. So that's why it's important to look at these initial and special and so forth and sign up when you do need the coverage and are eligible for it. This is just a chart that goes over that. And so original Medicare is the primary payer. In most cases, original Medicare is your primary payer for healthcare services when you are 65 and no longer working. Medicare Parts A and B provide good basic healthcare coverage, but like I've said before, they were never designed to cover everything. There are deductibles, co-payments, and co-insurance amounts that are your responsibility. In addition, original Medicare does not cover outpatient prescription drugs. So what are your options for additional coverage when you have original Medicare? Well, some of you are fortunate and maybe have group retiree health coverage from a former employer. And they are basically saying, hey, when you turn 65 and you're no longer working, Medicare will be your primary payer. And then we have secondary coverage for you. So that's something good and something that you'd want to investigate, see how much it costs and what the coverage is like. Other people say they want a Medicare supplement and a Medicare Part D plan, or some people may want a Medicare Advantage plan. Okay, so now we're going to get into the nuts and bolts of Medicare Part A benefits. Most of this information is also in the 2021 Medicare cost sheet that I gave you. So Medicare Part A helps cover the following services: hospital stays, skilled nursing facility stays. Remember, skilled nursing facility stays is rehabilitative in nature. It is not simply custodial or long-term care. Home health care services provided in the home by a skilled medical professional. Hospice care is treatment for someone who is terminally ill, and any blood we receive while we're in the hospital or a skilled nursing facility stay is also covered. You know, unless you're going to be asking me a question, could you all please mute? Hello? If you-
Diane, you do have a chat and the question in the chat, which I think Maura is trying to ask you.
Oh, because okay.
Yeah.
You know, I'd be happy to answer the question. It just says she has a question. I'd be happy to answer it. I don't know what the question is, though.
Okay.
The question isn't in there.
I have a question in regards to Medicare Part A and also Part B. I'm on the call because my husband is registered for a Part A only right now because I have coverage with my employer for Part A and B. Right, I don't see a question. Okay. Maura, maybe you can ask a question in the and that Diane can answer. Maybe not. Okay.
So 2021 original Medicare Part A, what are your costs? Okay, because everybody wants to know what you're responsible for. So first of all, I just want to say that Medicare Part A has a very unique benefit period. You would think that the benefit period for Part A would start when your Medicare coverage kicks in, but actually the Part A benefit period begins when you go into the hospital as an inpatient. So if a person is admitted into the hospital as an inpatient, just so you know, Medicare will give you 60 days of full hospitalization coverage, but you will have a deductible first. And that deductible this year is $1,484. So that's it. If you have a Medicare supplement, just so you know, that deductible can be covered by most of the supplements, but you do have 60 days coverage in full for that hospital stay. In addition to those 60 days, Medicare provides you with another 30 days of hospitalization coverage, but they don't cover that in full. You would have a co-payment of $371 per day for that per benefit period. So if I was in the hospital, just say 70 days and within one benefit period, I'm looking at co-payments of what, 10 times $371. However, if you have a Medicare supplement, that $371 co-payment is paid for as a basic benefit under all Medicare supplement plans sold, period. So each benefit period under Medicare Part A, I have 90 days of hospitalization coverage. So sometimes a person might need more than 90 days within one benefit period. So Medicare provides them with what are called lifetime reserve days, an additional 60 days of inpatient hospital days. However, my co-payment would be $742 a day. Again, if I have a Medicare supplement, that co-payment is covered as a basic benefit under all Medicare supplement plans sold. So let me just explain something really quick. Your benefit period begins when you go into the hospital as an inpatient. Well, when does it end? If we know when it begins, of course, we want to know when it ends. Your benefit period would end 60 days after your date of discharge from the hospital or a skilled nursing facility. So if I went into the hospital October 5th, first day of my benefit period, and I'm released October 15th, and I go for 60 consecutive days without being readmitted into a hospital or a skilled nursing facility, 60 days after October 15th, probably like December 15th, December 16th, my benefit period ends. Okay, so what if I go back in the hospital December 28th? I start a fresh benefit period again. And even though I have another deductible to meet, I can get that covered by a Medicare supplement plan if I wish. When that new benefit period starts, I have those 90 days of coverage replenished. 60 days covered in full, 30 days with the co-payment. And that co-payment, like I said, if I have a supplement, is covered as a basic benefit under all Medicare supplement plans sold. So even though the benefit period is a little unique and difficult to understand or even explain with Medicare Part A, it really is beneficial for us all. So you can be starting and stopping different benefit periods throughout the calendar year. Oh, and I also want to mention that with this, if you are buying a Medicare supplement, you will receive an extra 365 days of hospitalization if all of your other hospital days under Medicare A run out. Okay. So 2021 original Medicare Part A, what else are your costs? Skilled nursing facility coverage. Now, remember I said earlier that skilled nursing facility coverage is basically rehabilitation care in a facility. So Medicare says they will cover 100% of the stay for the first 20 days. You do have to meet some qualifications though, and that would be you had to be in the hospital 3 full days as an inpatient. Your doctor had to prescribe the care, and of course you need to be admitted into skilled nursing facility within 30 days of being discharged from the hospital, which most people just go from hospital straight to skilled nursing facility. And then of course another one is you have to use a Medicare approved skilled nursing facility. Easy enough to do. So first 20 days are covered in full. If you should need to stay in the skilled nursing facility longer, Medicare will provide an additional 80 days of coverage known as days 21 through 100, but you have a co-payment, and your co-payment each day would be $185.50 per day. If you are buying a Medicare supplement, that is covered by many of the Medicare supplement plans. However, it is good to know because not everybody buys a Medicare supplement or do they have any other secondary coverage. So you may say, okay, I have 100 days of skilled nursing facility coverage. Remember, this is under a Part A benefit period. So if you are admitted into the hospital October 5th and you're discharged October 15th, and now you go into skilled nursing October 15th, and you stay there for 30 days until November 15th, when you're discharged from that skilled nursing facility, if you go 60 days with 60 continuous days without being readmitted to the hospital or a skilled nursing facility, your benefit period will end 60 days after, did I say November 15th? So that would be what, January 15th. And then the next time you go in the hospital, your hospital days are replenished as well as your skilled nursing facility days. So don't look at this as 100 days per calendar year. It's 100 days within a Part A benefit period. So hopefully you'll find that helpful as well. And just keep in mind, this is rehabilitative in nature. So even though Medicare provides you with up to 100 days, that doesn't mean a person actually gets or even needs 100 days. As probably most of you know, if someone is in a skilled nursing facility and they've been getting rehabilitation care and they've gotten to a point where they're not, they're not improving anymore, maybe they've improved to the point they can go home, great. Maybe they've just improved to a point where they might not be ready to go home, but they're not getting better either. Or maybe they just don't want the therapy any longer. Then they can't really stay in skilled nursing facility care any longer at that point either. But that would be up to the therapist and so forth at the skilled nursing facility to determine that with the patient. Okay, original Medicare Part A, we have 3 other services that are covered by them. Home health care services, which are medical services you receive in your home by a skilled medical professional. Your costs are $0 for Medicare approved services. Hospice care, care for someone who's terminally ill. Your costs are $0 for hospice care, and a co-payment of up to $5 per drug that a person would need to control their pain and discomfort. And a person would also be responsible for up to 5% for inpatient respite care. So what is that inpatient respite care? So if someone is receiving hospice, they are usually receiving it in their home or their caregiver's home, something like that. But there may come a time when the caregiver cannot provide care, that maybe they are ill or they have a work-related function or something. So Medicare says that for up to 5 days, a patient can go into an inpatient facility and Medicare will pay 95% of the cost for up to 5 days. The patient is left with the remaining 5%. It usually is a very small dollar amount, but then that can be covered by most Medicare supplement plans sold since 2010. And then there's a blood deductible. Your cost of the first 3 pints of blood for each calendar year. Sounds sort of crazy that they call it a blood deductible, right? But actually the cost of blood varies from region to region. So they just say we're responsible for the first 3 pints. And if you are buying a Medicare supplement, that's covered as a basic benefit under the Medicare supplement plans. So also with blood, if you are an avid blood donor, you may not even be charged for the blood. It just depends on if you've given blood in the past. And I also want to mention that any drugs that you receive while you're an inpatient in the hospital are also covered under Medicare Part A. So we just talked about Medicare Part A. Now Medicare Part B is a lot easier because with Medicare Part B, it's typical of insurance that we've had sometime during our working lives. There's a deductible, and then the insurance company, in this case, Medicare, pays 80%, and we're responsible for 20%. So an 80-20 plan subject to the deductible. So what is the standard monthly premium this year? $148.50. It can be more based on income. Here is a little blurb about the IRMA, again, income related monthly adjustment amount. And again, if you want to know more about that, that would be in the 2021 Medicare cost attachment that you were all sent on page 2 of that. So Medicare Part B covers physician's care, outpatient care, lab tests, x-rays, home health services, durable medical equipment, other medically necessary services like ambulance, emergency room, other supplies like diabetic testing supplies, like lancets and that sort of thing, physical, occupational, and speech therapy, and many, many preventive benefits. So again, how are these covered? Very straightforward. Your cost this year for the calendar deductible, $203. Fortunately, the benefit period under Medicare Part B begins January 1st and ends December 31st. It's not a very unique benefit period. It's one that we are accustomed to. And then after the deductible is met, Medicare pays 80% of the Medicare approved amount for the covered service, and we are responsible for the remaining 20% of the covered service. Now that 20% is covered as a basic benefit under Medicare supplements, and most of them will cover that full 20% in full. So that's good to know as well. So if I go to the doctor and he charges me $100 and they send the bill to Medicare, Medicare is going to look at, oh, if Diane received a bill for $100 for an office visit, it doesn't mean they're going to pay 80% of the $100. They're going to have an approved amount for that service. And let's just say that approved amount is $80. If that is the case, then Medicare will pay 80% of the $80, which, as you know, is $64. I would be responsible for 20% of the Medicare approved amount, which in this case is $16. And the doctor would receive $80. Now, is the doctor going to be satisfied with receiving the Medicare approved amount? Maybe, maybe not. It depends. We have to use doctors that accept Medicare for Medicare to help with any of the bill. But some physicians accept Medicare only, and other physicians accept what is known as Medicare assignment. So doctors who agree to accept Medicare assignment will agree to accept that Medicare approved amount as payment in full, and they will be satisfied with receiving that amount. But doctors who accept Medicare only, and that's totally okay, that's totally their choice, they can charge me an excess fee. That excess fee can be no more than 15% of the Medicare approved amount for doctors who do not accept Medicare assignment. So 15% of the Medicare approved amount is $12. Because remember, just one moment, please. Todd, could you take her out? Thank you. I'm sorry, I have a dog, I can hear her crying. So the doctor charged $100. The Medicare approved amount is $80. Doctors who accept assignment would be happy with receiving that approved amount of $80. Remember, 80% comes from Medicare, 20% comes from me or my supplement. A doctor who accepts Medicare only can charge an excess fee over that approved amount, which was $80. 15% of $80 is $12. I don't know about you, but I would be happy to pay the $12 out of my own pocket to see the physician that I wanted to see. However, not all doctors' charges are going to be $100. It might be $50,000 if it was surgery that I needed. So then, of course, the excess fee would be much higher. So it may be in your best interest to use doctors that accept Medicare assignment. However, if you are looking for a Medicare supplement plan, there is a Medicare supplement plan that will cover the excess charges for you, which would give you the option of using doctors that accept Medicare and assignment as well. Now, a common question at this point is someone will say, well, how do I know if my doctor accepts Medicare or Medicare assignment? Well, you could call the office and ask if the doctor accepts Medicare, and they should be able to tell you, obviously, right? But some people who answer the phone really don't know if the doctor accepts Medicare assignment. They might not even know what it is. So a way for you to do that, you could go to medicare.gov, and in the search engine up on top of the page, you can just say doctors who accept Medicare. And it'll take you to another site where you can look up any doctor in the country and find out if they accept Medicare and if they also accept Medicare assignment. Also, you could look up the doctor's website. Usually it tells you there as well. But I would, go to the medicare.gov website and find out, do they accept Medicare or do they accept Medicare assignment? Okay, that's just a little bit more about Medicare and assignment, Medicare but not assignment. So Medicare provides a lot of Medicare Part B preventive benefits. For many preventive services, the annual Part B deductible is waived, which is good, not for all of them, but for many of them. Additionally, if your physician accepts Medicare assignment, then they will accept the Medicare payment as payment in full from many preventive services. So accepting the Medicare payment as opposed to accepting the Medicare approved amount is different, because the Medicare payment, Medicare just sends them something, right? And for some of those preventive services, the doctor will accept that Medicare payment as payment in full. For the approved amount, Medicare is paying 80% and you or your supplement are paying the remaining 20%. So I'll talk about a few preventive services next, but I just want to let you know that if you want to learn more about the preventive services that you may be eligible for, Medicare provides great brochures. One of them is the preventive benefits. Last time I checked, it's about 32 or 34 pages long. It talks about the service, who's eligible, how often, and if the deductible is waived, and if you get the service, will the doctor accept the payment as payment in full from Medicare. So that is a really good and worthwhile booklet to get. So ask your doctor, if you're going to be going on Medicare soon, about the Welcome to Medicare preventive visit. Many doctors offer that, not all. So you'd want to ask, do you offer the Welcome to Medicare preventive visit? If they do, great, because then they will bill Medicare accordingly and you won't have to worry about paying for something. This is available one time during the first 12 months that you have Part B. Diabetes screenings are available to you up to 2 times in a 12-month period. There is a Medicare diabetes prevention program. I still show new in there because it's been around since 2019. However, I don't think it came in the beginning of 2019. It came at the end of it. So I don't really know how many of those programs really took place during like COVID and so forth, unless they were given during Zooms. So if someone is pre-diabetic, please ask your doctor about diabetes prevention programs. Sometimes those are given at local hospitals as well. Depression screenings, a person may be eligible for that. Mammograms, prostate cancer screenings, colonoscopies, and other types of colon cancer screenings, bone mass measurement tests, obesity screenings, pneumonia shots, hepatitis B shots, flu shots, tobacco use cessation counseling sessions. So if someone is smoking and they would like to quit, they can get help quitting smoking by by going to 8 sessions during a 12-month period. And they also have alcohol misuse screenings as well. So we've talked a lot about what Medicare covers, and Medicare is really good health insurance, by the way. If you haven't had personal experience with it, you've probably had relatives that have had experience with original Medicare, and it is very good coverage. However, it doesn't cover everything. Dental is not covered by Medicare. Routine eye exams relating to the prescribing of glasses is not covered. Routine physical exams, hearing aids and exams for fitting them, cosmetic surgery, massage therapy, and concierge care are not covered. And neither is healthcare outside the United States. So if you are planning on going on a trip outside the United States, please, there are companies that sell coverage just for you outside the country for emergency care. Allianz is one. Another one is Geo Blue, GEO Blue. That's by the Blue Cross and Blue Shield Association. You can buy a out-of-country plan. It's based on your age and how long you're going to be outside of the country. So that's really good to have. The supplements do have limited coverage for emergency care, but as you'll see in a moment, it's pretty limited. So here is a summary of the items that Medicare A and B leave you to pay. So if some of you have secondary coverage available to you from your former employer, this is a good sheet for you to ask them, well, will the secondary coverage cover the Part A deductible, the hospital co-payments, the skilled nursing co-payments, hospice inpatient respite care, and the 3-pint blood deductible, the Medicare Part B deductible, the 20% that Medicare Part B leaves us to pay, and excess charges. Remember, that's what a doctor can charge us if they don't accept assignment. So now we move on to the last part of this program, and this is the briefest part actually, Medicare Supplement, Medigap insurance plans. And remember, you can get a Medicare supplement if you're going to be getting original Medicare A and B. If you have a Medicare Advantage plan, you cannot and should not buy a Medicare supplement plan. So Medicare Supplement Insurance Plan, also referred to as Medigap, are health insurance plans offered by private health insurance companies that help supplement original Medicare. If you are within 12 months of turning 65, you know that you are getting information from all these different Medicare supplement plans within the state of Illinois. I think there are over 40 companies selling Medicare supplement plans in Illinois. These plans help with the deductibles, co-payments, and co-insurance amounts that original Medicare leaves you to pay. So in order to buy a Medicare supplement, you have to have Medicare A and B. You do not have to have, if you're looking for a supplement now for January, you do not have to have your Medicare A and B now. You can shop, you can enroll for a January 1st effective date, but that Medicare A and B will need to be effective January 1st as well. Okay, so Medicare Supplement Open Enrollment Period. When is the best time to buy a Medicare supplement? The best time is to purchase a Medicare supplement policy during your Medicare Supplement Open Enrollment Period. This 6-month period begins on the first day of the month in which you are 65 or older and enrolled in Medicare Part B. So for my fictitious person who is 67 and needing Medicare Part B and a supplement, say for January 1st, they have a 6-month enrollment period that starts when Medicare Part B kicks in. So if they are enrolling for Medicare Part B for January, they have a Medicare supplement open enrollment for January, February, March, April, May, and June. Okay. They can shop now for that January effective date if that's what they wish. The open enrollment period allows you to purchase any Medicare supplement plan that's sold in your state of residence. Now, every Medicare supplement policy must follow federal and state laws designed to protect you. Only standardized plans can be sold, and they are identified by letters A, B, C, D, F, G, K, L, M, and N. All right. All of these policies offer the same basic benefits. I'll go over what those are. There's just 4 of them, but some offer additional benefits, so you can choose which one meets your individual needs. Now, please note the statement at the bottom. Since January 1st of 2020, Medicare supplement plans sold to people who are new to Medicare as of 1/1/2020 and later won't be allowed to cover the Medicare Part B deductible of which is $203 this year. That was a rule that went into effect last year. It had been ongoing for quite some time, but last year was when it became effective. Because of this, plans C and F, because those 2 cover the deductible, will not be available to new Medicare beneficiaries. However, if you were eligible for Medicare before January 1st of 2020, but you did not yet enroll, you may be able to buy Plan C or Plan F. Not that you'd necessarily want to, but you have that option. Okay, so what are the basic benefits of a Medicare supplement plan? Those hospital co-payments, remember, $371 a day for days 61 through 90, $742 a day for days 91 through 150, plus the Medicare supplements provide an additional 365 days after Medicare benefits are used up, if that should happen. Medicare Part B coinsurance of 20%. That is covered by all of the plans. However, some of them cover it a little bit differently. Plans K, L, and N pay for the Part B a little bit differently, and we'll talk about that. The blood deductible covered by most plans in full, except for K and L, and the Part A 5% hospice inpatient respite care coinsurance covered in full by all plans except for K and L. But this makes more sense. And you all have this chart too that was sent to you. So what I've done up here is list all of the Medicare supplement plans that are available in the country. All right. And then over here on the left, I've listed all of the costs that Medicare A and B leave us to pay. And these are the ones that are covered by Medicare supplements. So Medicare supplements are great. Medicare A and B is great. The only thing that's a little unusual is that they're all called letters of the alphabet, which is crazy. So Medicare A and B, not the one on this page, but what we've been talking about all this time, that's the foundation of your medical care. Think of it as the foundation of your home, below the basement or the basement. And on top of that, you build another floor. So on top of your Medicare A and B, you supplement it with a Medicare supplement known as A, B, C, D, F, G, etc. So Medicare supplement plan A covers basic benefits only at 100%. The hospital co-payments, the 20% Part B leaves you to pay, the blood deductible, and the Part A hospice care coinsurance of 5%. Supplement Plan B covers those 4, plus it covers the Part A deductible, which this year is $1,484 per benefit period. Supplement Plan C, which most of you are probably not eligible for, but some may be, covers the first 4 benefits at 100%. It covers the skilled nursing facility care co-payment of $185.50 per day. It covers the Part A deductible and the Part B deductible. It also covers foreign travel emergency. Oh, some of these plans do that. However, I told you it was rather limited. So if you are outside of the country and during your first 60 days of travel, you have an emergency, you would have a $250 deductible to meet, and then your Medicare supplement would pay 80% of eligible expenses up to a lifetime maximum of $50,000. Now, that benefit, just like most of these Medicare supplement plans, were developed in 1992. And that foreign travel emergency benefit was sweet in 1992, but not so much now. So if it were me, I would still get something else. So Supplement Plan D covers those first 4 basic benefits at 100%, the skilled nursing co-payment at 100%, and the Part A deductible. It does not cover the Part B deductible or excess charges. Because remember, excess charges are important because that allows you to go to doctors who only accept Medicare and you don't have worries if they accept assignment or not. Now, Plan F covers the Part B deductible and is probably not eligible for most of you, or you're not eligible for Plan F. Covers the first 4 items at 100%, covers the skilled nursing at 100%, Part A deductible, Part B deductible, and excess charges at 100%. And the reason Plan F was so popular for so many years was because it covered everything at 100%. It was a very nice plan. However, in 2010, 11 years ago now, Plan G was improved upon, and Plan G then started to look just like Plan F with one exception. As you can see, it's 100% for the first 4 basic items, the skilled nursing co-payment, the Part A deductible, and the Part B excess charges. The only thing Plan G does not cover is the Part B deductible, which we all know is $203 for this calendar year. So even if you are eligible for Plan F because you were Medicare eligible before 1/1 of 2020, usually there is such a big price difference between F and G that you would just normally go toward G anyway. So Plan G, for most of you, is the most comprehensive plan you can buy. It is a very good plan. Plans K and L, they're a little different. They pay the hospital co-payments at 100%, as you can see, but for everything else, Plan K pays it at 50%, Plan L pays it at 75%. There are out-of-pocket limits on those so that if you would reach a certain dollar amount, and I think it's $6,220 for Plan K and $3,110 for Plan L, then those 50%, 75% benefits become 100%. However, most people do not buy Plans K or L. Plan M is a Mary, first 4 basic benefits covered at 100%, skilled nursing at 100%, and the Part A deductible only at 50%. Plan N is a plan that some people ask about, and Plan N is less expensive than Plan G. Why is that? Well, the hospital co-payments are covered at 100%, and the Part B co-insurance of 20% is covered in full, except for if you have a physician office visit, you would be responsible for a co-payment, never more than $20. So Plan N has office visit co-payments that you may be responsible for. It could be $10, it could be $8, but never more than $20. It covers the blood deductible in full, Part A hospice care co-insurance in full, skilled nursing, and the Part A deductible. The Part B deductible is not covered, and neither are the excess charges. Also on Plan N, you would have a $50 co-payment for emergency room visits unless you were admitted into the hospital, and then that $50 co-payment is waived. So Plan N is less expensive than Plan G, mainly because it does not cover excess charges and because you have a co-payment when you go to the physician's office. There are also 2 other plans. You can see F has an asterisk and G has an asterisk because those come as high deductible options too. You could buy regular Plan F or regular Plan G, or you could buy high deductible F or high deductible G. The high deductible this year for those plans, $2,370. And remember, with Plan G, you'd also be responsible for the Part B deductible of $203. So you have options. If you want a Plan G, you can buy full Plan G or Plan G high deductible. So before I answer any questions, which entity provides Medicare Part B? The federal government or an insurance company? And if you're feeling shy and just want to put this in the chat box, that's fine too. Does anybody know who provides Part B? Yes, Nancy? I can't hear you. Could you unmute? Oh,
Number 1,
right.
the federal government.
Thank you. Okay. And thank you, Carol, too. Okay. Thank you, Nancy. Great. Yeah, you know, you wouldn't believe how many people will say, I need Part B. And they'll tell me the insurance company they want it from. I'm like, oh no, Part B comes from the federal government. But people get Part B and Medicare supplements confused sometimes. But not this group. So another question, if a 64-year-old person is already collecting Social Security benefits, what do they need to do to enroll in Medicare? Do they need to go online and enroll in Medicare 3 months before they turn 65? Or do they need to do nothing? Since they are receiving Social Security benefits before age 65, they will be automatically enrolled in Medicare A and B. They will receive their Medicare card in the mail about 3 months before their 65th birthday. So back to my question, if they're 64 and collecting Social Security, do they do one or do they do two?
Two.
Good.
One.
Did someone say
Two.
one? Okay, if not, we have to go back to the beginning. I think you
Two.
all. Thank you. And then the third question, John Smith did not enroll in Part B at age 65. And when he chooses to do so later, he is not going to get a penalty. For which reason did John not enroll in Part B at age 65? Was it because he didn't feel like signing up? Was it because he didn't want to pay the Part B premium? Or was it because either he or his spouse are still working for a company with 20 or more full-time employees and he receives his insurance coverage through that employer? 1, 2, or
Three.
3. I'm gonna check real quick in the chat boxes. 1, 2, 3. Okay, good. Okay, perfect. All right. So that's where I get my information from, is Medicare and Social Security. So how about if we have some questions? No questions at all?